Okay, Bismillah ar-Rahman ar-Rahim. We'll begin, inshallah. Bismillah ar-Rahman ar-Rahim. Alhamdulillah, nasta'inuhu wa nastaghfiruhu wa na'udhu billah min shururi anfusina wa min sayyiati a'malina man yahdihillahu fala mudilla lahu wa man yudlilhu fala hadiya lahu. Wa nashhadu an la ilaha illa Allah wa nashhadu anna sayyidina Mawlana Muhammadan abduhu wa rasuluh. Sallallahu ta'ala alihi wa ashabihi wa sallam tasliman kathiran kathira. Subhanaka la ilma lana illa ma 'allamtana innaka antal alim al-hakim. ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to our webinar on a 5-step guide to permissibility of haram medication, or the subject of tadawi bil muharram. In this subject, inshallah, we will talk about a number of different things which have interesting importance. But what I'm going to do is I will sort of go over the basic principles, inshallah, and then as I go through the basic principles, I'll give you plenty of opportunity to ask questions related to this particular topic. So before I begin, let me just mention something quite important for us to realize before we even discuss the whole concept of permissibility of haram medication. So, okay, let's do a sort of a comparative thing between when is it right or wrong to use medications or drugs or therapies in Islam. So when we are looking at this from a solely secular worldview, okay, and we're looking at it from the sort of perspective, and clearly when we talk about a secular worldview, we are in essence talking about conventionally practice medicine. Okay, so how we practice medicine today. So this way of practicing medicine is something that has arisen from a very clearly secular framework. Okay, from natural science, which does not have any kind of addendum to it, which has any form of relationship to theology or faith or religion. So on the basis of this, when we talk about harms on medication or permissible medication from a generic term which can apply to Muslim, non-Muslims as well, we make reference in particular to things such as harm. So what is harmful? So i.e., for example, even when we discussed or there was a large discussion regarding COVID vaccinations, for example. Yeah. So the big discussion around COVID vaccinations was, are they safe or were they safe? And that discussion was mainly framed around the idea that how we trialed and tested them enough to be assured that there is some element of safety in their use. And when we have that kind of sort of level of discussion, there are a couple of things that we want to relate to. First of all, we want a cohort sample of patients who have clearly had this vaccination or this particular treatment, and we recognize there is a clear safety index. And we know through clinical trials, which are robust clinical trials, like randomized controlled trials, that there is clear evidence that there is, safety. And we can judge safety on the basis of immediate effects, whether they are safe to take on an immediate sort of perspective, i.e. an outcome within the next few weeks, or we can look at it from a long-term perspective. So we're looking at months to years even, yeah? And do they have a safe profile over a number of months and years? And we get quite bogged down by that discussion. And that is the most important discussion. The reality of that discussion is that it solely makes relevance our physical body and our physiological, our biological components to our body. Okay, so it's only making reference to what we can see or sensory perception, and where we can clearly have empirical studies that can assess and measure the level of harm, if that is considered as harm. And that's about it, and that's as far as it goes. But from an Islamic perspective, there are elements within the Quran where Allah subhanahu wa ta'ala says, Alif Lam Mim, ذَلِكَ الْكِتَابُ لَا رَيْبَ فِيهِ هُدًى لِلْمُتَّقِينَ. الذين يؤمنون بالغيب ويقيمون الصلاة ومما رزقناهم ينفقون. الذين يؤمنون بالغيب, those people who believe in the unseen. Allah subhanahu wa ta'ala makes reference to those people who believe in the unseen. Now, clearly what is meant there is that truth that we cannot perceive through our sensory perception. We cannot see it, we cannot hear it, we cannot smell it, we cannot taste it. We do not have the cognitive capacity to grasp it in its reality, even. Yeah. And clearly, if we can't do that, then we can't even have the instruments or tools to measure it or to even identify its existence. Because science or natural science only deals with the natural world, and it only deals with matter, yeah, and any elements associated with matter, but does not deal with metaphysical elements. So hence science cannot answer the question of is there a God, because God, or if there is a God, yeah, is not a science question. Yeah, it's a theological question. It's a metaphysical question. So on the basis of this, our realm of discourse around medication in particular and drugs and their safety and avoiding their harm is framed from a natural science perspective, which is solely secular. However, as I mentioned in the Quran, Allah subhanahu wa ta'ala says that in believers, the Muslims believe in the unseen. And if something cannot be sensory perceived, nor can science measure it or prove that it exists, then how do we get that knowledge? And the only way we get that knowledge is sima'an, yeah, and that is naqal, through transmission. So Allah subhanahu wa ta'ala informs Jibreel alayhi salam or the Prophet sallallahu alayhi wasallam directly, and through transmission of the Sahaba radiallahu anhum and the Tabi'een and the Tabi'een and so forth, generation from generation, we have a robust line of reliable narrators who transmit this knowledge to us. And this is the kalam of Allah. It's the truth, yeah, and it's affirmed by true transmission, reliable transmission, and also faith in the reliability of the Quran and the Sunnah. On the basis of this, we then are informed about those things that science cannot identify or measure or even give us some kind of understanding of, like Jahannam and Jannah, heaven and hell. Science cannot tell us about them. Okay, science cannot tell us about malaika, angels. Science cannot tell us about jinns. Yeah, they can tell us maybe about the physical effects or material effects of these entities, but it cannot tell you about them in their essence. And this is, and even ruh, our soul. Science cannot tell you much about our soul because the soul is a metaphysical discourse. Okay, and Allah subhanahu wa ta'ala has made it very clear that this is the Amari Rabbi. This is the matter only for your Lord, and it's not within the realm of our understanding to comprehend the makeup of the essence of the ruh. Okay, so why am I mentioning this? I'm mentioning this because we don't always realize that when we take certain medication or certain drugs or certain substances, that we focus solely on their physical and psychological harms, but we fail to grasp there are spiritual harms. And these spiritual harms, as Muslims, can be more harmful to us, yeah, as part of our belief framework, than even the physical or mental harms. But we have more of a focus on those physical mental harms because they have an impact on our daily routine in how we engage with the world, and hence they have some sense of importance. But we do this at the cost of not appreciating and realizing the spiritual harms that affect us on taking those things that the Quran has prohibited. So if the Quran prohibits something because it says there is darar in this, harm in this, and clearly it's not making reference to physical harms, it's making reference to spiritual harms. So spiritual harms will have an impact in terms of our reformation as Muslims, It'll have an impact in terms of the barakah that we have in those things that we do. It will have an impact in the sense that we will end up becoming sinful if we take them on the basis of a situation where we're not excused. So those things will accumulatively have a serious negative effect on our salvation. So spiritual harms are very, very important. Hence, we have, this webinar. We're going to just discuss a sort of 5-step approach to how we assess whether medications or drugs have harmful effects for us and whether in certain circumstances it is permissible. And if it's permissible for you to take them. So in the Sharia, there is hukm taklifi shar'i, which allows you to take them and permits you or has dispensation for you to take the applicable medication. Then in those situations, you are not sinful. Even though potentially some of those spiritual harms can still occur because there is a sense of harm in them. But you are not held accountable for taking them. Right, so we have, for example, verses of the Quran which clearly stipulate حُرِمَتْ عَلَيْكُمْ الْمَيْتَةُ وَالدَّمُ وَلَحْمُ الْخِنْزِيرِ وَأُهِلَّ لِغَيْرِ اللَّهِ. Forbidden to you food are maita, the dead animals, cattle, beasts, not slaughtered, blood, the flesh of swine, and that on which Allah's name has not been mentioned while slaughtering, i.e. that which has been slaughtered as a sacrifice for others than Allah subhanahu wa ta'ala, or has been slaughtered for idols, and that which has been killed by strangling or by violent blow or by headlong fall. So you have all these sort of stipulated situations where Allah subhanahu wa ta'ala is saying that I have given you a hukm. Yeah. These are the awamir of the Sharia. I have given you a hukm not to consume these substances. Okay. Now, the important point to take here is this bottom bit here. So we have here, he has also forbidden you dead meat and blood and the freshest swine and that on which any other name has been invoked besides that of Allah. But if one is forced by necessity, without willful disobedience, nor transgressing due limits, then it is guiltless. فَلَا إِثْمَ عَلَيْهِ. There is no sin upon them. For Allah is most forgiving and most merciful. Okay? So this is the important point. Allah subhanahu wa ta'ala has clearly outlined explicitly in the Quran that there is dispensation for this. In other words, there is no haraj on you. There is no harm upon you from the sense of accountability. Okay? You are not sinful if there is a Shari dispensation. So we're going to talk about those dispensations. We're going to talk about 5 steps to us grasping and understanding of those particular dispensations. And that's what this particular session will hopefully be about. Can you see the slides? Because I'm getting messages saying that you can't see the slides. Can you see the slides? Oh, okay. Some of you can, some of you can't. All right, okay, that's strange. I don't understand why that may be. Okay, right. I can't understand that because half of you are saying you can't see them, half of you can see. Okay, anyway, the main point is that when it's out there on the webinar recording, then inshallah you should all be able to see them. Yeah, so yeah, those of you who can't see it, I suggest you log out and log back in again. Maybe you can see them there. Okay, inshallah. Now, so that's the Quran. Then we have the Sunnah of the Prophet sallallahu alaihi wasallam. And I'm just going to make very brief reference to this. I'm not going to go into the ilmi sort of deep discussion regarding this because I think it's worthwhile just knowing that. Okay, so somebody's telling me it's been minimized. Yeah, I understand now. Some of you are using the phone, some of you using your laptop, and hence there's a difference. Okay, that's fine. But when you have the recording, final recording, inshallah, you should be able to see the whole slides. So anyway, Anas radiallahu anh narrates that some people came from the tribe of on Urayna. So this is a tribe, okay? These people came to the Prophet sallallahu alaihi wasallam and became, because they were very unwell, and they came to the Prophet sallallahu alaihi wasallam during the time of the Prophet sallallahu alaihi wasallam was in Medina. The Messenger of Allah sallallahu alaihi wasallam commanded them to go to the milk camels and to drink their urine and milk for their treatment. Now, the point here was that these tribespeople, they came to the Prophet sallallahu alaihi wasallam and they had, quite a lot of sort of gastric problems. They had severe diarrhea. They had immense swelling, and I would probably say, from my understanding, because I remember teaching the ahadith from Sahih Bukhari on this and looking into the details, I would say that they were cirrhotic, so they had cirrhosis, and probably any additional sort of element to that. So cirrhosis is an outcome of certain underlying condition, usually the case. So, but knowing the underlying condition would be a different discussion altogether. But generally speaking, they were very unwell, to that degree that this was a life-threatening condition. Okay, the Prophet sallallahu alaihi wasallam told them, go to the suburban areas and drink go to the milk camels and drink their urine and their milk, and this will be treatment for you. So that's what they did. We went to the suburban areas and they drank the milk of the urine of the camels. Okay, and when they did this, they improved, their health improved, and they became well. And then the hadith continues. What happened was they apostated from Islam. They killed the shepherds. They stole the camels, and then the Prophet sallallahu alaihi wasallam punished them for that. Okay, and the main point to take from this hadith is this idea that urine, according to majority of the schools of fiqh, the Hanafi and the Shafi'i and the Hanbali, urine is najas, so it is haram to consume, even the urine of a camel. Okay, so on the basis of this, something which is, even though the Malikis would consider this urine of a camel not haram to consume, but the main point is this, that this is the main jumhur fuqaha, most sort of scope of the fuqaha, the jurists, indicate very clearly, because urine is haram, the Prophet sallallahu alaihi wasallam permitted them to consume urine in this situation because of their severe illness. On the basis of this, the fuqaha say this is hujjah, this is proof that you can take a medication for medicinal reasons or substances for medicinal reasons that contain haram ingredients or contain haram. If it's justified and it qualifies. And in this instance, it qualified. So now they make a whole framework of what those qualifications that are required should be. And this is what we're going to talk about. We have another hadith from Anas ibn Malik, who narrates that the Messenger of Allah sallallahu alaihi wasallam permitted Zubair and Abdurrahman radiyallahu anhuma to wear silk because of the itching they suffered. Now, this is a situation where clearly pure silk for men is haram. Okay, so wearing silk is haram for men. And in this situation, they had scabies, it's said, or a serious itch, and clearly the itch would settle depending on the material of the clothing that they were wearing. And at that time, the Prophet sallallahu alaihi wasallam indicated that they should ideally wear silk, and on the basis of this, he permitted them to wear silk, so that the itching is reduced. So the question arises, itchy body, yes, it's a sickness, or you could fall into the realm of illness, but it's not severe, it's not life-threatening. Now, this is a time of jihad, so maybe there is some kind of connection with the fact that clearly if you are itching all over, then you are putting yourself at risk if you are going and doing jihad. And that could be a possible explanation. But generally speaking, the main point to take from here is that even in non-life-threatening conditions, taking a form of medication or treatment that contains haram ingredients is permissible, even if it's not life-threatening. So even in the state of durura, necessity, and what we consider as haja, yeah, a high level of haja, taking medication containing haram ingredients would be considered as permissible. That is what we call rukhsa, a dispensation in those particular conditions. So that's the point to be taken from here. Okay. So on the basis of that, we will now draw up the framework that the fuqaha have drawn. I will try to answer your questions. So do, you have questions, do put them on chat. And every so often I will prompt you. If anybody wants to come on live, I'm more than happy for you to come on live and ask the questions as well, inshallah. Okay. If you want to ask any particular questions, please do raise your hand. And inshallah, I will allow you the mic to answer some of those, to ask your questions. So we got Shahriya, who's asking, which pharmacological effect can be expected by drinking urine of camel? Is camel urine part of prophetic medicine? Does it still have any significance in traditional medicine? Very good question. The answer to that is probably more so is that drinking camel urine was khas for the tribe of Ukla and Uraid. Okay, it was specifically for them. It was a treatment specifically for them. So that isn't to say now, as a general rule, that you can take it, yeah, as a form of treatment for certain conditions, or it's considered as prophetic medicine, because the fuqaha recognized that it was specific for them. And there is even a question that the Prophet ﷺ was given wahi, revelation, in relation to that treatment, and hence clearly there will be a level of certainty, in fact, in terms of its effectiveness, okay, as a form of treatment for them. So that would be a response to that. So no, you don't drink urine camel. It wouldn't be permissible for you to do that, unless you're amongst the Maliki fiqh, where they can give certain concessions in certain circumstances. Okay, so there's a number of questions that are arising, like, for example, children's paracetamol contains alcohol. Is this permissible if the child has high fever and things like that? Okay, we'll come to that in a second. We will address some of those questions, inshallah. So do keep posting those questions, and then inshallah we will try to come back to them, inshallah. Okay, right. So like I said, if anybody has any questions, please do raise your hand. Admin, if you allow our viewers to raise their hands if they want to, so that I know, inshallah. Okay, let's move on to the next bit. Let's go into the guidelines. So what are the guidelines for the use of haram medication in Islam? And here we will allow a form of interaction. Okay. The first thing to understand in this particular instance is the first step. Okay. And the first step is related to the concept of immediacy. Immediacy. Immediacy in terms of necessity to preserve life. In other words, there is a risk of death, and it's an immediate risk. In that circumstance, so this is the first step, if you're in a situation where somebody will die if they are not treated, yeah, and at your disposal, you have certain means, yeah, and they are the only available means, then even if those means are haram, okay, this is like immediacy in terms of drugs or medication, and they contain haram ingredients, or even wine in that instance. If there is a 50% risk to the life of that person, so there's a 50% chance of them not surviving or dying if you just leave them, in that instance, you can use those means. It'll be permissible for you to use those means. There is a qaida, adururatu tabih al-mahdurat. The necessity permits the prohibited, because this is a state of dururat, i.e. necessity, or dururat, necessity. Therefore, the mahdurat, the prohibited is permitted in that situation. Okay, so that's the first instance. Now, this has to be in reference to a situation where a person will die, and it's a sense of immediacy there. Okay, so that's the first point. So this is the first step. Okay, and within that, no threat of death. If there's no threat of death, but just used for purposes of treatment, a cure, or a remedy, there is a difference of opinion. Okay, now clearly, if it's just any kind of sickness that a person may have, even a mild headache or something, generally, if it's just, i.e., unqualified in this sense, it's just the fact that somebody's got certain symptoms, it's not permissible, according to Imam Abu Hanifa, Imam Muhammad, Imam Shaykh. So in other words, most of the schools do consider it not permissible. Imam Malik would say generally it would be permissible, and it's generally permissible except khamar, according to Imam Tahawi, who is also from the Hanafi madhab. Okay? Okay, I will sum all this up in a second, so don't worry about the detail. The main point to take from here is from a Hanafi perspective, and I'm making reference to a Hanafi perspective, and the perspective of all the madhahib. This is sort of generally understood. From the mutaakhirin fuqaha, from the Muslim jurists later on, they've all concluded that there is a general permissibility to take medication that contain haram ingredients, but there are very clear conditions, and those conditions will be the 4 remaining steps that I'm going to talk about. And this is a position of Imam Abu Yusuf in the Hanafi, and the fatwa is on that. Okay, so in essence, the general gist of this is if there's a sense of immediacy. So let me give an example of immediacy. Somebody's choking. They've consumed a morsel of food and they are choking. And clearly, if they are choking, one possible way of getting rid of this or dealing with that issue or resolving that issue is for them to dunk something down, like a liquid, so that it can push the obstructing morsel of food down, or down the gullet if it's choking them in the gullet. Yeah. If it's going down the windpipe, then clearly that's not going to be very effective unless it's stuck somewhere higher up where it can go down the gullet. In that instance, then you can dunk something down. So clearly the most obvious thing would be any kind of liquids. And it will be the halal liquids. Let's say there are no halal liquids. The only thing that's available is wine. In that instance, it will be permissible for that person to dunk down the wine to do that. And this is very clear in the fiqh literature. Another example would be, because there's a more than 50% chance of that person dying if you don't do something about it, and hence this is the situation. The other instance would be in a situation where somebody is in the middle of a desert, there's no food, the only thing that's available is swine, let's say, pork. It's the only thing that's available. Then in that situation, when that person, if they don't consume anything, they will starve to death. That person is permitted to consume swine, okay, or pork, just to the degree that they can survive. Okay, so hence in those situations, because there's a sense of immediacy there. Okay, and then other situations where there is no immediacy, but there is clearly some element of harm, then according to the general fuqaha, it is permissible for them to take medication that contain haram ingredients. And now there are, like I said, 4 conditions to this, which will be our next few steps in this regard. Okay, so there's a lot of questions regarding alcohol. Non-halal gelatin, considering that gelatin is produced through istihala. Okay, we'll talk a bit about that. I'm not going to go into the details of everything because it's not possible for me to go through the details of everything. I can't possibly cover everything in one session. We've got a whole course that we can cover all these issues with. So I will talk a bit about the course later on, inshallah. Okay. If anybody wants to speak or ask any particular question related to this slide, you can ask if you raise your hand. Okay, we've got Tahira Ahmed. Want to ask?
Hello, Assalamu alaikum.
Wa alaikum salam.
I just wanted to have some clarification on the flu vaccination for children.
Now you're going to a deep question and we haven't even gotten to the presentation yet. You ask the question, and I'll try to answer your question later on when it's relevant. Go on. So ask your
Yes,
question.
we often
Okay.
have letters for consent for our children to have the flu, um, the drops.
Yeah.
So would that come under the category of necessary?
Okay. So when you're talking about the flu vaccination, you're
I
talking
don't
about
mean
the nasal
vaccination, I
spray.
mean the drops, sorry, the actual drops that they give in schools.
Okay. Um, so you're not talking about the Fluenz nasal spray, no?
Um, what they give, I think it's normally nasal drops, what they give at schools.
Okay.
Yeah.
And the reason why you're asking that question is because it contains gelatin. Is that correct?
Yes, that's right.
Okay. So
Yes.
we will address that point, inshallah.
Thank you,
We'll address that
Jazakallah.
later on, inshallah. Okay. Wa alaikum salam.
Okay.
Okay. Right. So let's just move on, and then we'll come to some of these questions. There are a couple of questions here that we will address as we go along. Okay. Right. So step two. The effectiveness of the medication must be generally acknowledged by medical science. Now, what that means is there has to be some evidence base that that medication is effective. Okay. So that is a clear element of this. Yeah. So let's say this medication doesn't contain any haram ingredients. Now, in that situation, there's no issue with you taking it. Okay. It's permissible for you to take that. Even if you have minor symptoms, not a problem. You can take that medication. It's mubah. There's clear permissibility in doing that. If the medication is physically harmful, so it hasn't got any haram ingredients, but it's physically harmful, then there's an issue. Okay, so that may be considered as number one, makruh, or it may even be considered as haram. So if you're doing it solely for recreational purposes, then clearly that's a different subject altogether. So we will talk about those issues as well, i.e., taking narcotics and things like that, and taking drugs, taking marijuana, taking cannabis, and all those kind of discussions, which are for recreational purposes, and even taking marijuana and cannabis for medicinal reasons. That will be discussed in the course because there's a whole detailed session on just on that topic. However, we're making reference to the principal points here. So here, the effectiveness of the medication must be generally acknowledged by medical science. What does that actually mean? It means that there has to be reasonable evidence to suggest that cure of illness or relief of symptoms. So the first thing is that the treatment that we're giving you, there has to be some evidence base to it. Now, the only form of evidence base that we have available to us today is the evidence base that we have called the clear evidence-based medicine. So clearly there are trials that are being done, and we have some element of data that gives us a good understanding about the effectiveness of these particular medications. Okay, so we have a number of clinical trials. We don't have anything other than that. Okay, anecdotal components, which is how it worked historically in prehistoric times. They use anecdotal understanding. So, we tried this out a number of times in certain people and it seemed to work most of the time. And hence, that's how things used to work. So this element of tajriba, which is empirical, experience in other words, but is empirical, is something that the fuqaha clearly outlined even in classical texts. So the essence of empirical elements in terms of the level of experience and research that's been done in this, that shows and demonstrates that its effectiveness, and that will be an acceptable element to this. But the most important point to note here is that acceptance will be only based when it reaches the level of ghalabat al-dhann. Ghalabat al-dhann is an interesting concept, and I've written a whole article on that, inshallah, which isn't published yet. But ghalabat al-dhann, I would say, if I was to throw a figure at you, but don't quote me on this figure, it's just to give you a bit of an identity, because this is how we measure things today. We measure it in terms of percentages. Something is 100% effective, something's 50% effective, something's 75% effective. We use that, but for the fuqaha did not use that sort of approach. So but rather to give you an understanding of relativeness, to certainty and effectiveness, to something which is doubtful, then percentages are usually given, in common day sort of language. So I would say something that hits around about above 75%. Okay. Now, I, from my understanding and from my research, have come to the conclusion that Ghalabat al-Dhann has quite a spectrum, and it sort of exists from about 75%, which is between certainty and 50-50, to 100%. That would be falling within the realm of Ghalabat al-Dhann. Ghalabat al-Dhann at the bottom end and Ghalabat al-Dhann at the top end, depending on the seriousness of that condition, that would vary on that particular scale. But the main point to take is that the fuqaha understood it as you have a certainty element in you, that I know there's strong evidence to suggest this medication is actually very effective. And that would suffice. That would suffice, that you think that. And you know by the evidence base behind it. You can't just be an uneducated person who doesn't really know much about the medical sort of implications of taking a medication and make that judgment. It has to be done by a professional, which we'll talk about in a second. So it has to be justified, as medicine cannot reach the level of absolute certainty in accordance to Sharia notions. So you need the advice of a qualified health professional who respects patients' Islamic values. Now, in fact, the fiqh books mention Tabib al-Hadith, who is a Muslim. So they make reference that it must be a Muslim physician. Okay. Today, we don't just have doctors who prescribe. We have advanced practitioners who prescribe. We have other sort of professionals who prescribe as well. So people who prescribe can be more than just doctors. Okay. So what the reference is being made here too is anybody who has a certain accreditation and they are regulated in terms of their prescribing capacities. Okay. So anybody who falls within that realm would fall within this particular category, because there is an expectation that they know what they're prescribing, because this is clearly the sort of education that they've received, the experience that they have, and clearly they've been regulated to ensure that they prescribe safely. So when we have those kind of levers in place that assure us safety in that sense, then you want somebody who empathizes with your Islamic values. And that could even be a non-Muslim, because you could be in an area where there is no Muslim. And sometimes you could have a Muslim who's not even faith conscious, doesn't practice Islam, and he's not really faith conscious, and quite the contrary, in fact. So for that reason, it has to be, in essence, the illah there is that it has to be somebody who empathizes with Islamic values, okay, and recognizes that, and will make decisions based on that. So step 2 is effectiveness of medication, evidence-based, and it's been either proven to be evidence-based through research, and the individuals that you are approaching to get that advice is somebody who clearly is empathic to that discourse and giving you the right kind of advice in line with that. Okay, so that's step 2. Okay. Let me see if we've got anybody who wants to. Anybody got any question regarding this particular slide?
Yes, I have got a question. And
Okay.
Can you hear me?
Yes, I can hear you. Yeah, I think it's
Okay.
Yamina.
So
Yeah.
what about the narcotics that are given to cancer patients? They don't relieve any symptoms, just put the patient to sleep, and that's just for their pain relief and to put them on sleep. So are they allowed for the cancer patients to use narcotics?
Okay. So you're talking about opiates, presumably, yeah?
Yes, opiates. Yes, yes.
Yeah,
Yes.
that are given to patients end of life, maybe, or because
Yeah.
they got severe pain.
Yes.
So pain is a good enough indication for you to take medication that may contain haram ingredients.
Okay.
So that would be a good enough indication. Why? Because of the fact that when you have severe pain, it affects your functionality. Okay, so if it affects your functionality, that's what the fuqaha are interested in. So your engagement with society and your normal cortical functionality is impeded because of your illness or whatever it is, be it pain, be it weakness, whatever it is. Then on the basis of that, they would excuse it. So okay. But good question. Good question. Okay, right. Next one. Step 3. Step 3, its benefits must outweigh its harms. Okay, so there are certain medications out there. Let's say, for example, chemotherapy. Yeah, chemotherapy, discussions about vaccinations. Okay, very controversial. But anyway, the main point to take from this is that, okay, we recognize there are harms in there in taking up that medication, be it vaccine, be it medication, whatever. But the benefits outweigh its harms. Okay, now this can be looked at a couple of ways. Right. So let's say, for example, the benefits are immediate and they are quite long lasting, and the harms we're suspect of. We don't have a certainty in that, but there is some evidence to suggest that there may be harms in the long term, like 5 years or 1 year or 2 years or something like that. Okay. So immediacy takes precedent over longevity. Seriousness of the harm takes precedent also. Okay, so those two things need to be taken into consideration. There are certain maxims, qawaid al-fiqhiyya, that are used in the Sharia, like al-darar yuzal. First of all, harm must be eliminated. So that's the first thing that we must do. In this situation, we must eliminate your harm. La darar wa la dirar. There must be no harm when we take a medication or a form of treatment or intervention or reciprocating harm. In other words, by me taking that medication, it doesn't harm somebody else. Or by me undergoing that intervention, it doesn't harm anybody else. Let's say, for example, we can't retrieve a kidney from a live patient, okay? Or kidney would be a different situation, sorry. We can't retrieve the heart of a live patient for the survival of another patient because we're going to harm. That's reciprocating harm. You can't harm another for your own personal benefit. Okay, so that's a very important maxim. Another word is adurrul ashaddu yuzala bidurra akhaf. A greater harm is eliminated by tolerating a lesser harm. So if you have a severe harm and you have a lesser harm, then you can override the lesser harm because of the consequences of the severe harm. Okay, so as a calculative sort of approach to that, let's say, for example, there is a patient and the patient has a severe cancer, and there is a cure in the sense that we can remove that cancer, but it requires us to take that. Let's say it's a brain tumor. If we do brain surgery on this patient, we know that the intervention that we will do with the brain surgery, even though there's a harm related to the cancer, there is the harm of actually operating on this particular patient because they are frail, elderly. We give them general anesthetic and that may kill them. And we operate and then that may kill them. So on the basis of this, the harm of operating on this patient outweighs the harm of the actual tumor itself. So therefore, it will be haram to operate on this patient because of that reason, especially when you have a certainty component in terms of the outcomes of both those situations. So hence, that would be an example of harm must not be limited by an equal harm. Okay, so again, in this situation, if they're both equally harmful, you can't use an intervention of harm to remove a harm which is of equal measure. Okay, so what you do is you take the lesser of the two evils to be chosen. Okay, so the idea is that you pick the lesser of the two harms, which fulfills that sort of criteria that we talked about. Okay, so that's the next point to make sure. So in other words, it should not be harmful, or if it is harmful, the benefits clearly outweigh its harms. Okay, so chemotherapy is a good example. Chemotherapy has certain side effects. Okay, and there are clearly some harms in some types of chemotherapy. Okay, but the benefits may outweigh those harms. Longevity of life, quality of life. Okay, so they outweigh. And for that reason, it would be permitted for you to use chemotherapy for that reason. Okay. So if anybody has any questions they want to ask regarding that, you please do ask. I will come to some of these questions on chat, by the way. So I'm not going to ignore you, inshallah. I will come back to them one by one. But at the moment, we'll deal with the people who want to talk online, inshallah. So if there's no questions, no problem. So that's clear. Okay, inshallah. Step 4. Step 4, there is no alternative halal therapy remedy reasonably available of equal or greater effectiveness. So in other words, we're in a situation where there is a medication and it contains haram ingredients. Okay. However, we recognize there is other medication which is just as effective or more effective, which is halal. Then that medication that contains the haram ingredient will be haram. It will remain haram because we have a clear halal alternative. Give you another situation. That medication that we take, which will benefit us, okay, contains haram ingredients. And there is another medication that is halal, okay, but it's not as effective as this medication, which contains haram ingredients. Then in that situation, we can take the medication that contains haram ingredients. Let's say, for example, surgical treatment using valves. So we have porcine valves for the heart, okay? Porcine valves for the heart. And they are clearly made from swine, yeah, porcine. Now, and we have valves that are prosthetic. If there is evidence to suggest that they are longer lasting, the porcine ones are longer lasting, there is a lesser level of resistance to them, they are more effective in their functionality, and there's a lot of evidence for that, then you can use the porcine valve relative to the prosthetic valve. Okay, so that just to put that point to you. So that's the first thing. So such remedy may be a preventative measure. So it doesn't have to be medication, it could be interventions as well. So okay, and there is a maxim, al-mushaqqatu tajlibu at-taysir. Hardship begets facility. So in this situation, there's also a discussion regarding practical or reasonably in terms of cost effectiveness. If something is halal and it's equally effective or more effective, but it's very expensive and clearly problematic in that sense, then even in those instances, you can take the haram product instead. The other element here is in terms of local availability. If you have to travel immense distance and there is a serious amount of hardship for you to go and get this medication, so like, for example, types of heparin. So we got a situation, we're on a ward, there's a sense of immediacy as well because somebody just had a heart attack or something. And we are using heparin, okay, to thin their blood, okay, as an anticoagulant. And that heparin contains gelatin, for example, okay, or porcine. And the other alternative heparin that doesn't, like dolteperin, is not available in the hospital. We have to go to another hospital to get it. Now, we need it now. So in that sense, you can use that heparin. Or it's not available yet. There's a hardship of going and getting it from a different sort of town, whatever it is. And there's a number of days it'll take to get that, but the patient needs it now. So those elements are elements of hardship. Okay. So in those situations, there is a sense of excuse in the use of the haram ingredient medication. Okay. So that's step 4. Okay. Okay. If you have any questions, if you please post them on the chat, that would not the chat, the Q&A. Sorry, my fault. If you post it on the Q&A, that would be better. Then I have one area that I can look at afterwards, and try to answer some of those questions. Some of those questions I won't be able to answer because they require a long, deep discussion, and the course will do that. Okay, inshallah. Yeah, anybody want to ask a question regarding this? Yeah, we got I think Shahriya Iqbal.
Assalamu alaikum, Shaykh.
Wa alaikum salam.
I have a question, a similar question, but a little bit different scenario. Sometimes you have for a certain symptom or a disease, you have like equal medications. Some contain haram ingredients, some maybe not haram. And over time, for instance, if you treat coughing, then you try different medication. Like you start with the halal, but when you finish them or the patient didn't respond well, then maybe the haram medication are left. But if you look up the studies, they are not overwhelmingly better. Is it also a reason that we now can move forward to the medication that contain haram ingredients after we have tested all the other options, or does it not qualify to go for the other not usual permissible medication?
Okay, so let me sort of ask your question in my way, and then you tell me if it's right. This is what you're asking. So what you're asking is, you've given certain medication to somebody, which is clearly halal, and you're finding that they're not responding to that particular medication. You recognize that something else, which commonly is not known to be as effective as that medication, but yet is used for that particular treatment, or for that particular illness, you decide to use the haram one now because the halal one's not effective. Can you do that? Is that what your question is?
Exactly, because sometimes the response is very individual and you have to try out pharmaceuticals.
Yeah. Yes. So the response to that is that if you have exhausted the halal means, i.e. you've tried all the different types of medication and you've exhausted them, but yet that medication is licensed for this particular illness and there is evidence to suggest it does work, but it's not as effective as this particular medication, which is halal, that you've exhausted and you realize it doesn't work, then yes, it's permissible for you to do that. You can do that. Okay. Does anybody else? You've got Imran Ghazi? You've got a question?
Assalamu alaikum, Shaykh, can you hear me?
Wa alaikum salam.
Just a quick question. Obviously, working in primary care, we get a lot of cough or chest infections at this moment in time, and we prescribe a lot of amoxicillin capsules. If you were to prescribe the liquid version of it for patients, then obviously the ICB would call you up on that, or the formulary would say, stop prescribing the liquid. In that situation, what would you recommend, or what would the legal ruling be?
Okay, good question. Very good question. Challenging question. And I'll come back to you on that, inshallah, when we finish at the end, because I'm sure one of the questions on the chat will relate to that. But very good question. I will address that. Okay, I think they've got one more person. Is it Hamza? Yeah. You have a question?
Assalamu alaikum, Shaykh. It was just a similar question, really, with regards to when prescribing, for example, omeprazole, and then you've got capsules and then dispersible tablets, and then you're looking at if I'm prescribing as a GP and there's a sort of cost difference between the two, is it reasonable to justify prescribing the capsule over the dispersible tablet to a Muslim patient? If it's like a 50p or £1 difference, because I could be called out by the community pharmacist, for example, say, why are you prescribing capsule, dispersible tablets over capsules? So there's just that sort of internal sort of
very, very good question. Similar kind of question as the previous one. I will address it now, actually, because it's relevant to this step. Okay, so but you have to understand the nuances related to this question. So the first point is, okay, amoxicillin capsules contain gelatin. Amoxicillin capsules are considered as first-line therapy for, let's say, chest infections. So clearly they prescribed hugely. Okay, now in the UK context, I cannot comment about other contexts in different countries. I'm specifically making reference to the UK context. That's where I am. In the UK context, there is a fixed budget that we have for prescribing. If a few people prescribe medication which is more expensive than amoxicillin capsules, it will not impact the general budget in that sense. If majority of the people prescribe alternatives to amoxicillin capsules, for example, then it will have a massive impact on terms of the budget. When it impacts the budget, it causes a harm, and that harm is related to an issue of maslaha. Now, maslaha concepts, which means public harm at scale. economy of scale, harm at that level. When you start sort of talking about issues which start working on economy of scale, there is a certain concept in the Sharia that states that when you consider something a necessity is like when it is a real need, yeah, life-threatening situation, yeah, and there are dispensations in circumstances of necessity, yeah. When it comes to that issue affecting a whole community, like for example vaccinations, then there is a reduced threshold of acceptance of allowing that dispensation because it's at a bigger scale. So the question arises now with amoxicillin, there is an impact clearly on budget. So on the case of that, the first question that you need to address that with, is there an alternative to amoxicillin capsules? And you can apply it to lansoprazole as well if you want, okay, or any other kind of medication that contains gelatin. This is on the basis, because there are certain ulama who don't consider gelatin as being haram, by the way, yeah, and that is some area that needs a lot more. I'm not 100% convinced about the evidences that are out there that they are, soundproof, they're in the sense that they're completely, certain. So there is still a bit slight debate that could still be stated regarding the use of gelatin. But we're going to accept that gelatin is haram, full stop. Okay. On the basis of that, then the first thing you need to ask your question, go through those steps. Right. The first thing is, do we need to give this person amoxicillin capsules? Yeah. Is it, effective enough? Yes, it's very effective. It should deal with the infection. It's a first-line treatment, and there's a lot of evidence to suggest that. Number two, is it harmful? No, it's not harmful. Step 2, yeah, if you remember. Step 3, sorry. It's not harmful. In fact, clearly the benefits outweigh any of its harms. Step 3, okay, or step 4 now. Okay, is there any alternative? And the question arises, yes, there is alternatives. There is amoxicillin syrup, costs a few pennies more, okay, or there are other alternatives. Then it's better for you to then prescribe the alternatives if it affects your position as a practitioner, yeah, and you're in a situation that you will be held liable, yeah, or you will be penalized for doing that, okay, because clearly there is a prescribing directory, or there are prescribing guidelines, or the pharmacy, I don't know, the sort of the local prescribing authority has an issue with you doing this, or it sort of compromises your position in your practice and it affects your career basically, yeah. If it does that, it has to be something legit. It can't be just something, oh well, people might not be happy with me doing that, and that's it. It has to be something quite, quite effective in that sense. If it's going to impact you to that degree, then you need to sort of make a decision that, does this entail half of my job, 50% of the work that I do? Is it fundamentally about prescribing this haram ingredients in drugs? And if the answer to that is no, it's not, it's only about 10% of your work, then it's permissible for you to continue doing that, okay, in that situation. Even though, because it's impacting your role as a clinician. If it's not, then you should be prescribing alternatives in that sense. I know it's a very fluffy response and it's not very clear, but it's a very challenging question. And I can't give you a clear answer to that because I've not done the detailed research to actually say that on the basis of maslaha, it's better that we prescribe amoxicillin capsules in this instance, even though they contain gelatin. There needs to be research and there's to be a clear fatwa on that issue, which I can't give you because I haven't done the research on it. I plan to maybe in the future. So the point there is that if you're in a situation like that, and I think somebody mentioned some time ago, amoxicillin syrups doesn't cost much more than that. Then the question now arises, which is another very important question, which we will not address in this webinar, because it's just a webinar, but we will address in the course. The details of this I'll address in the course, okay, where I'll go right down to the evidence to support the claims that I'm making. But You know, am I sinful for prescribing something that a person wants, which is haram? So a person says, look, I want amoxicillin capsule, whether you like it or not. I want a capsule. So prescribe it. So then you are obliged to prescribe that because of your sort of, medical regulatory authority suggests that you should be doing patient autonomy. They can have it in capsule form. And in fact, if they want it, then you should prescribe it. That's a separate issue. You are excused from doing it anyway, because of the position that you're in. But we'll discuss that in depth, you know, in the course rather than in this particular session, inshallah. Okay, so I've talked around it without giving the detail there. But if you want the depth and the detail, then you have to join the course. And we'll talk a lot about those kind of things. The main point is that you're realizing there's so much to discuss in this area, and hopefully that will make the course very rich in terms of those kind of questions. Last step, sorry. The permissibility of tadawi bil muharram, meaning medication that contains haram ingredients, remains as long as the injury remains. And it's not just just confined to past or present, but also for certain future events. But effort should be made to find halal alternatives. A very important point. So the first thing is, as long as the injury remains, it is halal for you, i.e. you have rukhsa, you have a dispensation. As soon as you get better and you don't need it anymore, you must stop immediately. If you continue taking it, that's not permissible. Okay, so that's the first point. The second point is, we should not feel comfortable with taking medications that contain haram ingredients just because of dispensation. That's not the default position. The default position for Muslims is that we should take medication which is halal, full stop. So, in other words, there must be a group amongst us who should try to ensure and work on this idea that we do have halal alternatives for this medication. And it's not good enough that we just sit there and accept it and be passive to it and just start taking haram ingredients, because these steps allow us to do that. Okay, that is a very, very important point. Unfortunately, I don't see much happening in that area, which is very problematic for Muslims. There are certain maxims that harm is to be eliminated within reasonable limits. So, الضر يدفع بقدر الإمكان، or ما جاز لعذر بطل بزواله. A thing which is permissible out of excuse ceases to be permissible with the disappearance of that excuse. And la dar wa la dirar. There must be no harm, reciprocate. All these maxims suggest and indicate that point in step 5. Okay, so this is an important sort of issue that we need to consider. Right, so now what I will do is I will quickly swing through some of the questions that we have here. We got one person wanting to ask, Nabiha Butt, you want to ask a question?
Assalamu alaikum.
Wa alaikum salam.
Yeah, so my question is just around what you mentioned about patients wanting, for example, if we had a Muslim patient that came to us and said that they didn't want a medication antibiotic with gelatin, for instance, and we know that we would be penalized for doing the amoxicillin suspension. In that situation, would it be better to give the second line antibiotic in terms of resistance, or if we're found in that situation, for example, clarithromycin is second line for those that are allergic to amoxicillin, even though predominantly we wouldn't mention it and put it out there to every patient that, by the way, but if they happen to come to us and they say that they don't actually want a medication with gelatin, we know amoxicillin does have it, and we can't give the suspension because it's too expensive, and we would be penalized for that. So in that instance, for those patients, that small cohort, would we then start to issue the second line? And if they say, well, is it as effective as, say, the first line, would we then have to explain to them that, in terms of effectiveness as well, whether that could be, whether that couldn't be, but it might not be effective, and if it isn't, then we can give you amoxicillin if it comes back to us, sort of thing.
Okay, right. So, I mean, it's a very good question, a very deep question, very thought out question, actually. I'll tell you why, for two reasons. One is that there is a certain harm in the reasons why we have first line, second line, third line is not just solely because of their cost, and it's also because of antibiotic resistance. So in that sense, when we try to address that question, there is a clear harm. And the clear harm is if we end up in a situation where we got serious antibiotic resistance because we're using exhausting second-line antibiotics, third-line antibiotics, what we're left with. So we got some serious resistance now. And that could lead to a certain level of harm. So there's a whole framework that the Muslim jurists would work on, and that would be, okay, so if you're claiming, so I'm playing sort of devil's advocate, if you're claiming there is a serious harm in you using second-line, third-line medication, okay, prove it to me. And when you prove it to me, you need to be, with dominant probability that this is what's going to happen. And it's going to happen within a reasonable space of time that would justify me for me to say there is a dispensation here. So that's the kind of response a jurist would give you, a Muslim jurist would give you, a mufti would give you that kind of response. I'm not sure that we could do that. We know there's clear evidence that there is antibiotic resistance. But if a small cohort of the population was receiving second line, third line, yes, the antibiotic resistance would get a lot worse, but would it be significant enough for us to say, oh, this is really problematic, this is serious public harm? And the answer to that may be yes, but that needs to be quite a lot of work that needs to be done to prove that. But going back to the exact point of the question that you're asking, is that can we, because we have a certain obligation, and that obligation is that we don't prescribe haram medication or medication that's not justified from an Islamic perspective. Can we not just give a second-line antibiotic? And the answer to that is be honest with the patient. This is the situation. And rather, we should not. I recognize you're not really being deceptive to the patient. You're not saying, look, this is the normal antibiotic I normally give you, but because I have a moral obligation not to give it, I'm therefore going to give you a second-line antibiotic. And I'll be very open to that degree. I'm not referring to that, but there is something about, in the sense. So let's go to my practice. So the way I actually prescribe amoxicillin capsules. Yeah, I prescribe them, and I prescribe them, even to Muslims. In that sense, not just non-Muslims. I prescribe to non-Muslims because, from my understanding, the alternatives to amoxicillin are much more expensive. Okay, and we have our list presented to us in terms of our prescribing habits. And if my sort of prescribing sort of benchmark relative to other clinicians, it states very clearly that I prescribe cefalexin and all these clarithromycin, all these alternatives instead of prescribing amoxicillin. I'm going to have a lot of clinicians looking at me and thinking, what are you doing? What's going on here? And then I'd have an explanation to give. If I do it on odd occasions here and there, because somebody's clearly stated to me, look, this contains gelatin, can you give me an alternative? Then I'll give them an alternative. I won't hesitate about that. I'll give them an alternative. And the essence of this is that this is something that patients need to ask for. Okay, maybe there needs to be a greater level of education within our communities. They need to ask the doctors and the clinicians for halal medication. You're not held accountable for if you giving, if you don't prescribe second line like clarithromycin, you're not accountable for that. And that discussion will occur in the course when I go into a lot of detail related to that. This concept is called supporting somebody in committing haram. That's a whole discourse which we'll discuss in the course, inshallah. But generally speaking, I'm just giving you a gist of the kind of discussion that will occur around that topic. Okay, inshallah, right. Before we go to the checklist, let's just try to answer some of your questions. I may not answer all your questions because we've got limited time, and the other questions, some of them will be addressed in the course. Children's paracetamol contains alcohol. Is this permissible if the child has high fever? Very simple answer, yes, it's permissible. Okay, and very quick reasoning behind that, because the alcohol in children's paracetamol is not haram. Number two, is it permissible to consume cough syrup with alcohol in it? The answer to that is yes, it's permissible. Number two, if that person is drinking cough syrup with the intention of getting intoxicated on it, chances are that they probably won't, because they'll have to drink immense amounts of it. And that could be harmful, just the content of that, rather than the alcohol in there, before they actually become intoxicated. So on the basis of that, the other thing is that alcohol there, according to most of the jurists today, would say that that alcohol is not prohibited. Okay, even though it's ethanol, it's not from the ashraba arba'a. And that explanation, you'll have to go to the course and you'll gain that. Is it permissible to consume supplements for non-halal gelatin? So these are drinks, for example, or other sort of consumables that you can get, and they are just supplements. They're not necessarily medication prescribed. You're buying them from over the counter or something like that. Okay, and they're considering that the gelatin is produced through istihala. Ooh, right. Now that's a very loaded question. Now you're talking about istihala. Istihala is a process that transforms gelatin. So there's a conflict, a contradiction within the question. Okay, if it's gone through istihala, then that means it's no longer gelatin. Porcine. It would not be considered as porcine if it's gone through a process of istihala. Okay, so that's hopefully addresses your question. If it's istihala that's happened, that gelatin will be permissible. It won't be considered porcine then. So then it'll be permissible. But generally speaking, if it's nutritional drinks and they contain haram ingredients, they will not be permissible, because unless they're taken clearly for medicinal reasons and they are prescribed to you, or the doctor has clearly said that you need them. Okay, so that would be a difference. So we got a question. One of my aunt was put on morphine or some high drugs by the doctors in her last days of her life, suffering from cancer. Is this something permissible in the light of Islam? May Allah subhanahu wa ta'ala give us shifa kamila. The question itself has been addressed before. So morphine is given for a number of different reasons, for pain relief, for anxiety, and various other things. And it's given for medicinal purposes. So it's permissible for that particular reason, and it's justified. So Abdul Ahad's asking, being a doctor, I am curious, what are the commonly used medications which could be categorized as haram? I can only think of alcohol as preservative or gelatin capsules, I mean in allopathic method. So if you're using sort of methodologies of forms of treatment that are other than conventionally prescribed medication, if that's what your question is, then I can't answer that. Or I can answer is if they contain these ingredients, then that's a problem here, or it's not a problem. But we can talk about that in the course. If you join the course, inshallah, we will talk about all the different things that are haram and all the things that are not haram. So what about alcohol in a homeopathic medicine? Okay, even if it's ethanol, if it's not of the arba ashraba, then it's permissible. Okay. Please, can I see a slide for step 1 again? Okay, I'll show you that in a second. Are medicines containing ethanol permissible? The person wants to see the slide. This will be recorded and it'll be up on the webinar sort of thing. So you can watch the whole thing again and you can pause on the slide if you want to take notes, whatever you want. Are medicines containing ethanol permissible? Depends on what kind of ethanol it is, and it depends on what it's produced from. There's a big discussion about that, and also the percentage of alcohol. I've done quite a lot of research in this area. There is a paper that I presented at the Fiqh Academy in America. I didn't present it because I wasn't able to get there, but anyway, it was presented there. But I've done a paper, and I will discuss that in the course, inshallah, in a lot of detail. Within dentistry, minor oral surgery, is it permissible to have bovine or porcine bone products for the need of adding bone to the area for dental implants? The answer to that is something that I cannot respond to directly, but I can tell you that bovine is preferred over porcine, because porcine is najasul ayn, okay, it's much higher, and there's more stringent conditions required for porcine. The second point is that if the alternative, if porcine and bovine is more effective and it's recognized to be more effective, let's say, for example, it has a greater sense of longevity, in the sense of it's effective for a long period of time, then it'd be permissible for something like that. For dental implants in particular, because dental implants is a functionality. Okay, so clearly it would be permissible for that reason. Okay, where else do we? Okay, so we've addressed most of the Q&A, I think. Yeah, we've addressed most of the Q&A. Okay, inshallah. So hopefully, so can I ask admin to pull up the website? I'll just to this new course, so I can just quickly talk about the course. Okay, let me just share this course with you. Hopefully you can see the slides. Okay, yeah, you can see that. Okay, inshallah. So Fiqh of Halal and Haram medication, prescribing and pharmacy. So here, there's a couple of ulama who will be delivering on this and academics. So we'll be talking about in introduction and welcome, and then on there we'll talk about Muslim patients' behaviors and haram medication. So it's important to know the trend of how Muslims engage with haram medication. Do they take them? Are they conscious of it? Is there no problem there whatsoever? And is that the reason why so much medication is produced with gelatin and so forth? So that's a discussion in itself. Theology of use of medication in Sharia. So there is a theological position. So should we rely and have tawakkul, trust in Allah, than medication? Is there a time when medication is fard? Is it wajib? Is it necessary for takers? And if you don't take it, it's haram. Yeah, or we are sinful. So that's an important question. Other than that, sorry, that was just three. There's many more sessions on here. So we got a question on terminologies and sources of Sharia. So understanding the framework of the Sharia and how we link that in to the discussion on medication, it's important for us to understand that. The fiqh of alcohol in medication. So there'll be a whole discussion around alcohol and medication. Fiqh of gelatin in medication, the whole discussion about fiqh of gelatin in medication. There'll be something on the fiqh of other haram ingredients other than gelatin and alcohol, such as lactose and glycerin and stearic acid and toxins and things like that. Okay, there's also something on ethical guidelines for the prescribing dispensing. So this will be the same discussion I'm having now, but more detail to it, inshallah. And there's something about assisting in sin by prescribing. So this is that point that I raised earlier on. Are we, sinful for prescribing? Okay. Then there's something about the fiqh of pharmacy and pharmaceutical industry. So this is about the fiqh of pharmaceutical industry and the Sharia principles that are related to their ethics and how we engage with them, like drug reps and things like that. Okay. Fiqh of prescribing medication in psychiatry. That's an interesting area. So there are medications that we give in psychiatry that cause sedation. They are narcotic, they're tranquilizers, and various other drugs that we give in this situation. Are they permissible? I mean, with what conditions? Yeah. And then, inshallah, okay, sorry. Then the fiqh of prescribing medication end of life care. So this is about some of the things that we give in end of life. Withholding, withdrawing, and to some degree, some discussion around that as well. The fiqh of prescribing medication during Ramadan fasting. So in Ramadan, what is permissible for you to take? What's not permissible for you to take? What will break your fast? What will not break your fast? Such as, do injections break your fast? Are there certain other medical treatments that don't or do? Yeah, that kind of thing. And then there's something about halal and haram vaccinations. So, when does a vaccination become haram? And that question arose regarding fluenza vaccinations containing gelatin, clearly containing gelatin. The issue there is there a mafsada there? Is there a serious amount of public harm? That has to be weighed up. So we're going to talk about those equations, and those principles that we discuss in deciding whether things like that are halal or haram. And I'll do that in the course as well, inshallah. Then there's something about pandemics and vaccinations again. So that's very relevant to COVID discussion, for example. And then the last session is just a case study and Q&A, inshallah. So you can see there's a wealth of knowledge there and depth regarding this particular course, inshallah. So do please join the course if you have an interest in this area. Get others to join the course also that you know. And to be honest, if you are somebody who prescribes, I would say it is fard al-ain, obligatory upon you that you must know the rulings of the Sharia related to your prescribing. And I'm saying that with hand on heart. It is an obligation that you do this, that you have an understanding. Whether you join Al-Balagh Academy, that's up to you. But for you to gain this knowledge is an obligation. Yeah. And it's important that we understand that. And I will demonstrate that in the introduction, how important it is as Muslims that we do this. Otherwise, our earnings could be haram. And this is very, very important. Not only that, that if we are using a secular framework to make decisions, ethical decisions related to medication, that may also be haram. Okay, especially even if you are making the right decision and it's in line with the Sharia, because you've used a completely wrong secular framework in coming to that conclusion, that is problematic as well. So this is, you know, it's very, very emphatically stated in books of classical fiqh that, you know, the tabib, the doctor, must understand the Islamic ethics related to how they should conduct themselves in terms of even prescribing. So inshallah, we'll talk a lot about that in the course. Please do join the course, inshallah. Encourage others to do the same. And I forgive me if I've not been able to answer all your questions, but inshallah in the course we will answer virtually all your questions in quite a lot of depth. And you'll have the ability to engage with scholarly opinion, with ulama who have specialized in this area for more than 10 years, and also our medical professionals or chaplains who clearly engage with these kind of case studies regularly on a regular basis. So you've got an excellent team of people who will be delivering this course for you. So you know, it's a given that, you know, it's something of great value. There are very few, if any, courses like this around. So it's a very unique course for that particular purpose. Do join the course. It will benefit you immensely, and then spread the khair to others as well. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.